Private health insurance is a type of insurance that covers you and your family for a range of medical expenses, including costs that Medicare might not cover. The cover typically comes in two parts. You've got hospital cover and then extras cover. The problem is private health insurance premiums are no shrinking violet. However, as prices rise, health insurance comparison has gotten easier thanks to a move back in 2020 by the federal government to simplify hospital cover in particular. It's now in 4 clear-cut tiers: basic, bronze, silver and gold. While there are still plenty of options to weigh up within these tiers, streamlining the fundamentals means it's a lot easier to compare apples with apples and then switch if and when you find a better deal. For a lot of people, good hospital insurance is not negotiable. With a mother who's a doctor, that's certainly been drilled into me for many years. But what people don't realise is that you can switch providers as many times as you have hot dinners without having to serve a single extra waiting period if you stick to the same level of cover. However, if you are moving insurers, it's always worth asking them to confirm in writing which, if any, waiting periods might apply. Like most insurances, your hospital cover should not be something you set and forget, because for most people, as you get older, you might decide you need a bit more cover for things that you might not want to admit are wearing out, such as your eyes and your joints. Canstar's team of health insurance research experts crunched the numbers to rate health insurance providers based on price, cover, and features to help you compare your options. I once asked the ratings team to go through line by line every single price, fee and feature they compare, and honestly, I thought the meeting would never end. Never again. So don't send yourself blind by doing all of that work. Get the research team in Canstar to do the heavy lifting. When you've narrowed down your options, it's time to hone in on price. Plenty of insurers will offer you an upfront discount, but these sweeteners typically only last for a relatively short period of time. If you're someone who can commit to riding the sign-up discount train by switching regularly, go for gold. But if you know deep within yourself you're going to set and forget your health insurance for at least a couple of years, factor this into your thinking. I'm Sally Tyndall, Canstar's Data Insights Director, and to compare private health insurance options, come and visit us at canstar.com.au.